Good morning, everybody.
Good morning.
16 years ago, I had a potentially fatal disease, one that you can't see on a microscope. On the outside, everything looked great. I was successful, I was fit, I had a loving family, wife, 3 kids, and on the inside, I was dying, desperate, alone, and hopeless. And as I got sicker on the inside, I sought help. I went to my family doc. That didn't work. I then saw a string of specialists. That didn't work. None of the treatments worked, at least not right away. You see, the disease I suffered from was addiction. Following a 2.5-year odyssey of living with suicidal ideations and cycling in and out of countless treatment centers, hospitals, emergency rooms, intensive care units, and a whole bunch of other stops along the way, something clicked for me. And unlike a lot of people I met along the way, I survived. So why was it so damn hard? Why is it so damn hard for people to get well from addiction? Little did I know that that line of inquiry would be the genesis of an organization. I'm Kevin Kirby, and my organization is Face It Together. I, along with my colleagues, are out to fundamentally transform the way addiction care is delivered in the United States. 20 million Americans suffer from addiction. They're not the problem, nor are the tens of thousands of people helping them the problem. The problem is the system is broken. The system doesn't work. So if the purpose of the system is to get people well, then today the system suffers from 3 major challenges. 1, addiction is a chronic disease. And yet care, the system delivers care typically in, we all know, short-term kinds of episodic 28, 30-day stays. 2, the system gives us 1 data point for addiction recovery, sobriety. Well, a happy, healthy life doesn't lend itself to being boiled down to 1 data point. 3, the private sector, largely employers, bear the brunt of the enormous economic costs of untreated addiction. And yet, today's portfolio of tools available to employers doesn't work. So if that sounds like the perfect storm to you, that's what it sounds like to me. That's what it is. So at Face It Together, we are laser focused on those 3 challenges. First, we provide long-term care to reflect the chronic nature of the disease. And we do that using peer coaches. Now, why peers? Well, first, there's mountains of evidence that demonstrate that peers are effective at helping people manage chronic illnesses. Using peers also is cost effective, which makes it feasible to stay connected with people for the long haul. Second, we go way beyond the 1 data point for addiction recovery. We help every aspect of people's lives, not just those relating to drinking or using. Yes, consuming something is a symptom of this very, very complex biopsychosocial spiritual disease. Our app today enables our members to track their progress towards wellness in 62 areas. Everything from emotional well-being to relationships to a whole host of other variables. 3, this one's pretty simple. We give employers solutions that work. Our tools result in far more employees seeking and receiving the highest quality of care, thus delivering to employers return on investment. We've broken the code. We're able to attract private sector capital to this field that has been totally dependent upon the public sector and charity for far too long. starting from scratch in South Dakota 9 years ago, scaling into a handful of communities in the upper Midwest, and now into our first major metropolitan area in Denver, Colorado. We're designing, testing, and proving powerful new tools to remedy the failures of the past. We're getting people well. We're getting people well. We're getting people well in ways that go way beyond sobriety. So whether it's dramatic improvements in employment status after 30 days, or significant improvements in how we feel about ourselves, our emotional well-being after 120 days, or at a real practical level, after 180 days, dramatically decreasing the frequency with which we have to access today's expensive healthcare system. Our wellness measures have been validated by the scientific community. With the data we're collecting and analyzing, we're creating a whole new generation of addiction science. Experts in the field are reaching out to us to explore ways that they might incorporate our tools into their work. And we're attracting partners that can help us scale, foundations and large employers from around the country. We hope to be as disruptive to the field of addiction care, to the system of addiction care, as Amazon has been to retail, or as Uber has been to transportation. That's the scale of what it's going to take to deliver to 20 million American consumers what it is they want: wellness. We're convinced that objectivity, entrepreneurship, data science, and accountability to our members, to our partners, and to the communities we serve will give us all the tools we need to be successful. So if I leave you with nothing else today, try and take this with you. Addiction is a chronic disease. So is diabetes. So if I have diabetes today, chances are I know it. Chances are I received a diagnosis in a clinical setting, and chances are I've been connected with a series of evidence-based treatments. I'm learning new disease management tools. I've been treated with dignity and respect every step of the way, and there is no shame and no stigma about me getting me well. That's what people with addiction deserve. That's what I deserved. And at Face It Together, we're not going to stop until this is a reality. Why? Because 20 million Americans deserve nothing less. Thank you.